Well, Americans simply cannot afford to get sick right now. That's according to a new poll out from Gallup this week that showed over half of Americans cannot afford their healthcare costs.
My husband and I received a medical bill in the mail yesterday, which happens a lot because we have horrible insurance. Hey, Cigna, take that.
In America, anything can become a business, even healthcare. And just one hospital bill can bankrupt you. We have gotten used to paying for everything and calling it independence. We pay outrageous prices for medicine and treatment and then tell ourselves we are protecting ourselves. Until we look at Europe and realize that healthcare is treated as a basic right. And when people get sick, they do not have to start by asking, can I afford to be saved? Today, join me as we listen to the voices of people struggling with America's crushing healthcare costs. We are going to face the questions too many people have avoided for far too long. Who is the government really putting first? Do rich people and poor people deserve the same level of treatment? And why does a wealthy country still let sick people worry about going bankrupt, because this is no longer just about one patient or one family? It is time we face that painful truth. When Americans would rather stay in pain than call an ambulance.
My third favorite part of American healthcare is when you go to the pharmacy and pick up a prescription that you're waiting for, and they say to you, that'll be $687. And you're like, that's too much. I can't afford that. What is it after insurance? And they're like, no, that's after the insurance.
Do you know what really keeps a lot of Americans up at night? It is not rising home prices. It is not the warning light that just came on in the car. It is waking up one morning and realizing something feels wrong with your body, but the first thought in your head is not, what is wrong with me? It is, how much is this doctor visit going to cost? In America, an emergency can sometimes bring two fears at the same time. The first is that you may be in danger. The second is that if you make it through, a massive bill may be waiting for you afterward. I am sure you have seen this video at least once. A man is lying on a stretcher about to be loaded into an ambulance. Then just a few seconds later, he jumps up and runs like the ambulance behind him is the most dangerous thing on that street. The internet immediately understood the clip in a very American way. He just remembered the ambulance is not free. That clip may only be an internet joke. But the next story is completely real. In 2018, a 45-year-old woman got her leg trapped between a train and the platform in Boston. The passengers around her had to work together to push the train car away and free her. But while she was shaking and crying in pain, she still begged people not to call an ambulance. I cannot get past that detail. Her leg was badly injured, but there was still room in her mind for another fear of the bill. She had to wonder whether she could afford to be taken to the hospital. Of course, one meme and one woman are not enough to speak for all of America. But the next number is much harder to ignore. In a YouGov survey from 2024, 23% of Americans said they had deliberately avoided calling an ambulance during a situation where they needed immediate transportation into a hospital because they were worried about the cost. Almost 1 in 4, I had to look at that number twice. Now put yourself in that situation. It is the middle of the night and you suddenly feel chest pain. Your arm starts going numb. You know, something is wrong. But right before you call 911, you are still doing the math in your head. How much money is left in the account? Is the rent already due? How much will insurance cover? Or maybe you are not the one struggling to breathe. Maybe it is your parent, your spouse, or your child lying in the next room. Do you call the ambulance right away or try to drive yourself because the money you have left still has to cover food and electricity? That is the cruelest part. Illness does not care whether you just lost your job or are living off the last of your savings. But right when you were in pain and terrified, you still have to choose between your health and your money. Medical debt does not begin when the bill shows up at your house. It begins the moment someone in pain still has to ask, can I afford to stay alive, but why can nobody tell you ahead of time how much an ambulance ride will cost? To understand that we have to step into the maze of American medical billing. You can have insurance and still get a massive bill.
I was paying last year $57 a month premium, and then it jumped up this year to $16.90 a month. When I first saw it, I was surprised. I thought this was a mistake.
Honestly, I would think the same thing. Because it is hard to believe a bill can jump from $57 to $1,690 in just 1 year, then show up like that is completely normal. James earns an average of around $1,200 a month before tips. That means he could work all month, wash hundreds of dishes, make deliveries through rain and heat, then find out his entire paycheck still is not enough to keep his insurance. And please do not rush to say, James just needs to manage his money better. He is 62 years old, still doing physical labor and taking care of his unemployed sister. To make ends meet, he had to start collecting Social Security earlier than he planned. According to the numbers in the video, if he tried to pay the new insurance premium along with his other expenses, he would come up nearly $1,400 short every month. So what is James supposed to cut rent, food, electricity, or the little bit of money he hoped to save for old age? But there's one detail that makes the story even more painful. $1,690 is not the cost of treatment. That is just what James has to pay to keep his insurance. In other words, he has to pay a huge amount just to keep the card in his wallet. When he actually goes to the doctor, he may still have to pay a deductible copay coinsurance and services the insurance company refuses to cover. In America, you can pay for insurance, then keep paying just to use the insurance you already paid for. And James is not cutting out some luxury. He is cutting back on medicine. He needs medication to control his blood pressure, cholesterol, and diabetes. After losing his insurance, James started thinking about skipping his medicine for 1 week so the pills he had left would last longer. I want you to really think about that. James is not taking less medicine because his doctor said he was getting better. He is taking less because he is counting every pill. From that point on, his treatment plan is no longer decided only by his doctor. The amount of money in his bank account gets a say too. And diabetes is not the kind of disease that politely waits until you can afford treatment. High blood pressure does not wait either. Neither does high cholesterol. They can quietly get worse while the patient keeps working, keeps talking like normal, and keeps pretending everything is fine. Maybe you are not James, but there is a good chance you live with someone like him. Maybe it is your father trying to stretch out his blood pressure medication, your mother saying she will get checked next month, your spouse skipping a follow-up appointment because they cannot afford to miss another day of work. Or maybe you have stood at the pharmacy counter yourself, heard the price, gone quiet for a few seconds, then said, "I will come back later." That is when healthcare costs stop being numbers on a piece of paper. They start changing how people live, how they take their medicine, and how they endure illness. And this is the scariest part of American medical bills. It is not just that they are high, it is that patients often have no idea where the costs will stop. You may find out what disease you have before you find out how much debt that disease will leave you with, and yet some people still say patients need to pay more so they will take more responsibility for their health. I'm going to talk more about that. Take a deep breath and try not to get worked up. When your own health becomes the bet. And now we come to an argument that honestly bothers me more every time I hear it.
They are now arguing that they made our healthcare more expensive for our own good, folks. Just watch this.
You need to have a system that does both, takes care of you when you're ill and you're sick, but also incentivizes you to adopt healthy behaviors that keep you healthier and keep you out of the hospital. When there is a copay and a deductible, there's some skin in the game. Patients don't overutilize, and they're more likely to adopt.
The argument goes like this. Patients need to pay a part of the cost themselves. When they have copays and deductibles, they have skin in the game, so they will not go to the doctor too often and will have more motivation to live healthier lives. At first, that may sound reasonable. Healthcare does not have unlimited resources. Not every test is necessary. Doing more procedures does not always make a patient healthier. But now, put that argument next to James. Is James cutting back on diabetes medication because he is irresponsible? Is he stretching out every blood pressure pill because he does not care about his health? Or is he doing the only thing he can still do when his insurance costs more than an entire month of income? There is something deeply cold about saying sick people need to have skin in the game. This is not a game. What they are betting is their eyesight, or their kidneys, their heart, and their lives. I do not believe someone needs a bigger bill to understand that they should stay alive. The problem is that when costs go up, patients do not just skip unnecessary appointments. They skip medicine they actually need. They delay tests. They wait a few more weeks to see whether the pain goes away on its own. And by the time they finally reach the hospital, the illness may be much worse. And this is where the story starts getting truly controversial. Because if making patients pay more is the only way to prevent abuse, then why can millions of people in the United Kingdom, Germany, France, or the Netherlands still see a doctor without fearing a massive bill afterward? They do not live in some world where everything's magically free. They still pay taxes, insurance premiums, or contributions through their wages. But many of those systems do not use the fear of debt as a gatekeeping tool for patients. So how do they control costs? And more importantly, if someone in Europe can give birth, call an ambulance, or receive treatment for a serious illness without starting a repayment plan the moment they leave the hospital, why does that sound almost impossible to Americans? European hospital bills Americans can hardly believe.
Oh, I don't know how you feel about that.
I don't know if it's gonna be a real doctor or not. I don't know what kind of socialism this is. I know that the doctor did not actually cost $2, so who's paying for this? I don't know, but Is it even a real doctor if you don't have to pay $180 or $300 for your visitation? I don't know.
When you come to Europe, make sure your wife is ready for the shocker coming to a healthcare establishment and seeing a doctor. We just paid $2 for a doctor's visit.
If you're watching from America, what I'm about to tell you may make you think there has to be something missing from the story. But if you live in Europe, you may be wondering why going to the hospital without getting a massive bill is shocking at all. I once heard a Canadian woman living in Germany say that when she gave birth there, she received hospital's care, postpartum care, and even some baby supplies before going home. The cost she remembered most clearly was the parking fee. Wait a minute. She gave birth, stayed in the hospital, was cared for by medical staff, and the cost that stuck in her mind was parking. I understand why an American family might hear that and think there must still be a bill coming in the mail. Because in America, getting ready to have a baby is not just about choosing a doctor and setting up the nursery. You also have to check which hospital is in network, which doctors. Your insurance accepts how much of your deductible is left, and whether someone who unexpectedly joins the delivery team might be out of network. Maybe you are thinking childbirth is a special case. Then listen to the story of a man in Portugal. He was diagnosed with kidney cancer, had several specialist visits, MRI scans, CT scans, and surgery. He said the amount he paid directly was 75 euros. He also made it clear that he pays around 270 euros a month for insurance. And this is the part I want you to notice. That surgery did not magically become free. The doctors still had to be paid. The scanners still cost money. The operating room still needed staff and equipment. And that man was paying into the system regularly. The difference is that when he found out he had cancer, he was allowed to focus on getting treated. He did not have to sit there wondering whether the next scan would take away his rent money. He did not have to ration his medicine to make it last for a few more weeks. He did not have to call one place after another asking who would cover which part. If you're watching from America, a few questions have probably already popped into your head. How high are their taxes? How long do they have to wait? Does everyone really get those benefits? Or did the person telling the story leave out an expensive insurance plan? Honestly, those are completely fair questions. When you are used to premiums, deductibles, co-pays, and envelopes full of bills showing up after treatment paying almost nothing, could sound like a story with a few pages missing. But what bothers me is not just the difference in the numbers, it is the difference in what sick people are allowed to worry about. One person finds out he has cancer and gets to focus on how to keep living. James has to look at the pills he has left and decide which week he can go without them. One mother leaves the hospital remembering the parking fee. An American family may already be worrying about the deductible before the baby is even born. At this point, it is hard to stop at being surprised, because Americans are paying too. They pay taxes, they pay insurance premiums, and many get coverage through their jobs. But after all that, they still have not bought peace of mind. Of course, that money does not just disappear. Hospitals still have to operate and doctors still have to be paid. So how does the part of the cost patients never see get paid? And what does the word free really mean here? How Europe pays for healthcare differently from America. At this point, I know someone wants to correct this title right away. Nothing is free. And yes, they are right. Doctors still have to be paid. Medicine still costs money. Scanners, operating rooms, and ambulances do not appear out of pure kindness. But if we stop at they pay taxes, we still have not reached the most important difference. I used to hear the phrase free healthcare and think it was just a nicer way to say higher taxes. The more closely I looked, the more I realized the question is not whether people pay. Of course they do. The real question is like when they pay, how they pay, and how much they still have to carry on their own when illness suddenly hits. In many European countries, the money is collected ahead of time through taxes, social insurance, or payroll contributions. Employers may pay part of it too. Picture millions of people paying into one large pool while they are healthy. Then when someone needs surgery, cancer treatment, or emergency care, the cost comes out of that pool. And Europe does not use just one formula. In the United Kingdom, the system is funded mainly through taxes. In Germany, workers and employers both contribute to social insurance funds. In the Netherlands, people still buy insurance from private companies, but basic benefits are tightly regulated, and someone who is already sick cannot simply be denied coverage. 3 countries, 3 different systems. There is no single button labeled European healthcare. But they meet at one basic principle: someone who just lost a job or found out they have a serious illness should not instantly lose access to treatment too. To me, the word free is not the most amazing part. The amazing part is that patients can lie down for treatment without bringing the fear of bankruptcy into the hospital bed with them. And the easiest way to understand that is not by looking at slogans. Just put 2 people with the same chest pain in 2 different rooms, then see who gets to focus on breathing and who has to start doing the math. the same emergency. So why does the American have more to fear? Imagine two men, both 58 years old, both waking up at 2 in the morning with chest pain, trouble breathing, and numbness in one arm. One lives in America, the other lives in Germany. The pain is the same. The fear is the same. But the moment they pick up the phone, their stories start going in completely different directions. The man in America may have to think fast, call an ambulance or ask his wife to drive. Is the nearest hospital in his insurance network? How much of this year's deductible has he already paid? If he has to stay in the hospital, where will the family get the money? He does not even know whether he is having a heart attack or a panic attack, but money has already pushed its way between him and the decision to call for help. Of course, if it is a real emergency, the hospital will focus on saving his life, but being saved does not mean the bill disappears. After the test, treatment, and trip home, another journey begins. The hospital sends a claim to the insurer. The insurer decides what it accepts. Then come the explanation of benefits, the hospital bill, the doctor's bill, the lab bill, and maybe even a separate ambulance bill. He is trying to recover, but he is still waiting to see what other charges are on the way. The man in Germany also calls emergency services, is taken to the hospital, and gets the tests he needs. He is not being treated by magic. He is paid into the system through social insurance, and he may still owe certain charges under the rules. But most of the payment happens between the hospital and the insurance fund. He does not have to spend his recovery calling one place after another to ask who will pay for the night he almost died. I'm not saying the German system is perfect. Patients may wait longer for non-urgent services. Referrals can be frustrating. And in America, someone with excellent insurance may get fast care, more choices, and access to some of the best medical centers in the world. But I want to ask you a very direct question. What scares you more, waiting for a procedure that is not urgent or getting treated quickly without knowing how much money it will take from you? And how much does freedom of choice really mean when the best choice is something you cannot afford? You pay your whole life, but one illness can still wipe you out. If you live in America, you probably see money taken out of your account or paycheck for insurance every month. You pay taxes, you pay premiums, and when you actually see a doctor, you keep paying deductibles, co-pays, medication costs, and whatever the insurer refuses to cover. You are not standing outside the system demanding everything for free. You have been paying into it for years. What is hard to accept is that after all that money, you still do not know how protected your family really is. And if you are watching from the United Kingdom, Germany, or somewhere with universal coverage, this may be the hardest part to understand. Someone can pay for insurance for years, then still have to pull out a credit card or ask for a payment plan after one hospital stay. European viewers in the comments have also made it very clear that their healthcare is not paid for by money falling from the sky. They contribute through taxes, wages, or a social insurance. The difference is that when they need treatment, they are less likely to wonder whether the next bill will take away the rent money. Now let us go back to James. He is still working at 62, buying his own insurance, taking care of his unemployed sister, and trying not to become a burden on anyone. But when the premium rises to $1,690 a month more than he earns from his job, he starts stretching out his blood pressure, cholesterol, and diabetes medication. Maybe you are not James, but maybe you have postponed an appointment, left a prescription at the pharmacy, or told yourself you could put up with the pain for a few more days. And that is how one health problem becomes a problem for the whole family. You miss a day of work. Savings start running out. The bill goes on a credit card. The car repair gets delayed. Rent comes due. The next follow-up appointment gets pushed into another month. So if you have paid for insurance for years, but still have to borrow money when you need it most, what did all that money actually buy? And when a system creates this much fear, then the next question is almost impossible to avoid. Who benefits from keeping everything this complicated? Is American healthcare saving people or making money off sick people? At this point, I think it is very hard to keep blaming individual patients. When the same kind of pain keeps happening to this many people, we cannot keep calling it bad luck. Step back and look at the bigger picture. When you walk into a hospital, you think you are meeting a doctor. But behind that meeting may be a long chain of insurance companies, hospitals, clinics, pharmacies, drug manufacturers, pharmacy benefit managers, and sometimes even debt collection companies. I am not saying everyone in that chain is bad. Doctors need to be paid. Hospitals have to buy equipment. Insurance companies have to control costs. Pharmacies need workers and inventory. Every part of the system has a reason to exist. But when all those reasons pile on top of each other, the sick person ends up paying for the complexity. There is one story that made me stop and think for a long time. CVS Health does not just own CVS pharmacies. The company also owns Aetna, an insurance company, Oak Street Health, a network of clinics, and CVS Caremark, a pharmacy benefit manager. That means a patient can buy insurance, see a doctor, get a prescription, and buy the medicine inside the same corporate ecosystem. I am not saying that model is automatically wrong. Connecting different services could make things more convenient for patients. But when one company stands in that many places along the same journey, I think you have every right to ask who is watching whom. Are you really choosing, or are you just being guided from one door to another inside the same building? And what worries me most is how hard it is for patients to see where the money is going. Hospitals say they need high prices to keep operating. Insurers say that they have to cut costs. Pharmacies say they are negotiating for better prices. But the person at the end may still have no idea what a pill really costs, why insurance denied it, or why they owe that exact amount. And do not think this problem is fixing itself. The free clinic James went to said the number of patients who once had insurance but can no longer afford to keep it is rising fast. The person running the clinic said it was the biggest increase she had seen in 12 years of working there. It usually starts quietly. Premiums rise, you drop your insurance, you stretch out your medication, you delay appointments, then the illness gets worse. And eventually you end up back in the most expensive place of all, the emergency room. I understand that businesses need profits. Profits can drive research technology and new treatments. But there is still one question we cannot keep avoiding. What things are we willing to let society sell based on ability to pay, and what things should not be left entirely to the market? When someone needs insulin to stay alive, is that still just a normal transaction? The insurance card in your wallet may make you feel safe today, but James had one too. When you get sick, do you want to be seen as a patient, or a customer, or a business opportunity? After everything we have seen, the question was never just whether healthcare is really free. Of course, someone still pays. What matters is how the money is collected, who shares the risk, and who gets left behind when they can no longer afford to pay. When a very wealthy country still leaves a working person rationing diabetes medication, you have every right to ask, what is the government putting first, and who is it putting first? What do you think, is healthcare a basic right or just a service for people who can afford it? Someone with a higher income may be able to buy a better room and more choices, but when two people need the same medicine to stay alive, should the balance in their bank accounts decide who gets treated first? And this is the part I have the hardest time accepting. Why is it that in one of the most medically advanced countries in the world, someone can survive surgery and then spend years paying the price for having been saved? Leave your opinion in the comments. And share this video with someone who disagrees with you. Not so you can argue, but so you can answer one question together when people get sick. How do we want society to treat them?